Hello everyone, I am Ujjwal Thakur. Today we are launching World Health March. It is a social wing of Getbes that works for the people and helps social entrepreneurs achieve their mission the human way. Using this platform, we want social entrepreneurs to raise awareness among people regarding sensitive topics like cancer care, COVID-19, climate change, and every topic that impact people and their health. We celebrate first anniversary of Getbes with launch of World Health March. It is a global wing to help people live healthier. Now let's talk about workplace hazards that affect people's health. Effective controls protect workers from workplace hazards, help in avoiding injuries, illness, and incidents, minimize or eliminate safety and health risks, and help employees provide workers with safe and helpful working conditions. The processes described in this section will help employees prevent and also control hazards identified in the previous section. To effectively prevent and control hazards, employees should involve workers who often have the best understanding of the conditions that create hazard and insights that how that can be controlled. The second thing is evaluate and identify options for controlling hazards using a hierarchy controllers. The third is use a hazard control plan to guide the selection and implementation of controls and implement controls according to the plan. The third thing is develop plans with measures to protect workers during emergencies and non-authorities activities. The last thing is evaluate the effectiveness of existing controls to determine whether they continue to provide protection or whether different controls may be more effective. Identify control options. A wealth of information exists to help employees investigate options for controlling identified hazards. Before selecting any control options, it is essential to solicit workers' input on the feasibility and effectiveness. Select controls. Basically, employers should select the controls that are the most feasible, effective, and permanent. Next comes develop and update a hazard control plan. What a hazard control plan is? A hazard control plan basically describes how the selected controls will be implemented. An effective plan will address serious hazards first. Interim effective long-term controls of hazard. It is important to track and verify that controls remain effective. Select controls to prevent workers during non-routine operations and emergencies. The hazard control plan should include provisions to protect workers during non-routine operations and forcible emergencies. Depending on your workforce, these could include fires and explosions, chemical releases, hazardous material spills, unplanned equipment shutdowns, infrequent maintenance activities, natural and weather disasters, workplace violence, terrorist or criminal attacks, disease outbreaks, or medical emergencies. Non-routine tasks or tasks workers don't normally do should be approached with particular caution. Prior to initially such work, review job hazard analysis with any worker involved and notify others about the nature of the work schedule, and any necessary precautions. Now let's talk about implementing selected controls in the workplace. Once hazard prevention and control measures have been identified, they should be implemented according to the hazard control plan. Follow up to confirm that controls are effective. To ensure that control measures are and remain effective, employees should track progress in implementing controls, inspect and evaluate controls once they are installed, and follow routine preventing maintenance practices. The impacts of climate change includes warming temperatures, changes in precipitation, increasing frequency or intensity of some extreme weather events. and rising of sea levels. These impacts threaten our health by affecting the food we eat, the water we drink, the air we breathe, and the weather we experience. The security of these health risks will depend on the ability of public health and safety systems to address or prepare for these changing threats, as well as factors such as individuals' behavior, age, gender, and economic status. Impacts will vary based on whether a person lives, where a person lives, how sensitive they are to health hazard threats, how much are they exposed to changing climate impacts, and how they and their community are able to change the adaptation. People in developing countries may be the most vulnerable to health risks globally, but climate change poses significant threats to health even in wealthy nations such as United States. As the world gets hotter and crowded, our engines continues to pump out dirty emissions, and half of the world has no access to clean fuels or technologies. The very air we breathe is growing dangerously polluted. 9 out of 10 people now breathe polluted air, which almost kills millions of people every year. The health effects of air pollution are serious. One third of deaths from stroke, lung cancer, and heart diseases are due to air pollution. This is having an equivalent effect to that of smoking, tobacco, and much higher than that, the effects to eating too much salt. Air pollution is hard to escape. No matter how rich an area you live in, it is all around us. Microscopic pollutants in the air can slip past our body's defense system, penetrate deep into our respiratory and circulatory systems, damaging our lungs, heart, and brain. Air pollution is closely linked to climate change. The main driver of climate change is fossil fuel combustion, which is also a major contributor of air pollution, and efforts to mitigate one which improve the other. This month, UN International Panel of Climate Change warned that coal-fired electricity must end by 2050 if we are to limit global warming rise 1.5 cr. If not, we may see a major crisis in 20 years. The lack of visible smog is no indication that the air is healthy. Across the world, both villages and cities are seeking toxic pollutants in the air exceed the average annual values recommended by World Health Organization's air quality guidelines. The movements to control health hazard include all necessary steps to protect workers from exposure to a substance or system, the training and procedures required to monitor workers' exposure, and the health to hazards such as chemicals, materials, or substances, or other types of hazards such as noise and vibrance. Main way to control a health hazard include elimination, engineering controls. Let's talk about elimination. It involves remove the hazard from the workplace or substitute hazardous material or machines with less hazardous ones. And now engineering control. It includes modifications for designs to plants, equipments, ventilator systems, and processes that reduce the source of exposure. It controls that alter the way the work is done, including timing of work, policies, and other rules and work practices such as operating procedures, including training, housekeeping, and equipment maintenance and personal hygiene practices. Personal protective equipment. Equipment worn by individuals to reduce the exposure such as contact with chemicals or exposure to noise. The COVID-19 pandemic has actually fractured the financial system of globally, exposing age-old cracks within our supply chain systems. It is lethal shutdown rate of world economies has forced financial analysts against the world to rethink the connecting nodes of business value chains. A frontrunner in this race is remedy the situation in blockchain technology. Healthcare systems are overwhelmed with entrepreneurs and scientists securing to the air fall. Notwithstanding leading global corporations that have begun to implement blockchain-based solution to fight the pandemic of COVID-19. Benefits of blockchain in fighting COVID-19 being the digital ledger that blockchain is. It is distinguished features with each of them sufficient in and of themselves to power and enterprise blockchain adoption, both in the current healthcare climates as well as in the future. Trustable data management. One of the reasons the COVID 19 pandemic has hit us like a lightning is due to the outdated data management system. It outlined in its agenda is the need for a management system, nationwide electronic healthcare infrastructure with provisions of verifying identity of users and also the layer of security. Turns out that the coronavirus impact on blockchain value addition is right on the money. Blockchain can be used to manage, organize thousands of records with automated data verification and preferences. Decentralized surveillance system. Blockchain breaks the information barriers, silos, also allows in participating nodes to input ethical data without real-time piracy. We can begin by housing big data on a digital ledger for selected but trustworthy members of a global consortium with individual provisions for data sharing. Empowered supply chain management. There is a strong case for blockchain to be the antidote the frailing supply chain management needed. It can eliminate fraud and unwanted paperwork, track shipments to their source of origin, effective real-time transfer of funds, and also establish trust between parties. With blockchain, advanced disaster management can ensure that essential resources such as personal protective gear, masks, and medicines are stockpiled and diverted to the most vulnerable sections of the society. In this special day, the first anniversary of Getbes, we provide free AI use case consultation to everyone in this whole December. Thank you for watching. I am Ujjwal Thakur. I wish you a Merry Christmas and Happy New Year to everyone. Have a good day and let's hope that 2021 brings us joy.